went down the Affordable Care Act rabbit hole, and I'm genuinely shocked that Americans are not more outraged about this entire thing. The Affordable Care Act subsidies that the Democrats are requiring to extend in order to reopen our government are subsidies that are paid with taxpayer. Obama said you must use the Affordable Care Plan or pay a fine or get insurance elsewhere. You must have insurance. You must use Obamacare. It will be affordable. And then it ended up not being affordable at all. So we had to subsidize the cost of it with taxpayer money that is paid directly to insurance companies.
That's right.
Who are causing the driving up of healthcare costs in the first place. This is such a scam. And people aren't outraged. Like, it sounds so noble that the Democrats want people to have affordable health care. But Obama forced people to have affordable health care that wasn't affordable at all, so taxpayers have to pay it, but we pay it directly to the private insurance companies that make health care unaffordable. Can someone clarify if I'm missing something? Because this is wild.
The old piss on your head and tell you it's raining.
To the American people, if you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
If you like your doctor or health care plan, you can keep it.
Nothing in this plan will require you or your employer to change the coverage of the doctor you have.
The only change you'll see are falling costs as our reforms take hold.
If you like your healthcare system and your doctor, the only thing reform will mean to you is your healthcare will cost less. I will not sign a plan that adds one dime to our deficits, either now or in the future. It is a cost that will not, I repeat, will not add to our deficits. There will be a provision in this plan that requires us to come forward with more spending cuts if the savings we promised don't materialize. Because it is paid for and curbs the waste and inefficiency in our healthcare system, this bill will help reduce our deficit by as much as $1.3 trillion in the coming decades, making it the largest deficit reduction plan in over a decade. It will actually reduce the deficit by $4 trillion over the long term. Healthcare reform must be and will be deficit neutral in the next decade. We have built into law all sorts of measures that in the years to come, healthcare inflation, which has been rising about 3 times as fast as people's wages, is finally going to start slowing down.
We'll eliminate waste, fraud, and abuse in our healthcare system, but we'll also take on key causes of rising costs, saving billions while providing better care to the American people.
Reducing the waste and inefficiency in Medicare and Medicaid will pay for most of this plan. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies. Subsidies that do everything to pad their profits will start reducing the waste in the system, from unnecessary tests to unwarranted insurance subsidies, so that over time, Americans are going to save money. Families will save on their premiums. Businesses that would see their costs rise if we do not act will save money now, and they will save money in the future. And save a typical family an average of $2,500 on their healthcare costs in the coming years. Knowing you can offer your family the security of healthcare, that's priceless. Now you can do it for the cost of your cable bill, probably less than your cell phone bill. No federal dollars will be used to fund abortions. There are also those who claim that our reform efforts would ensure illegal immigrants.
At the so-called healthcare summit, February 2010, Tennessee Republican Senator Lamar Alexander got under Obama's skin by predicting that healthcare premiums would rise under Obamacare. Clearly irritated, Obama lectured the senator. This is an example of where we got to get our facts straight. And then Obama cited CBO projections that premiums would go down between 14 and 20%. It wasn't just Lamar Alexander. During the entire campaign to ram Obamacare down our throats, Obama and his party's leaders accused any critic of lying about what was in the plan and its impact. Well, The Kaiser Family Foundation just produced a new study showing that the average annual premium for employer-based plans costs over $15,000 a year. It's a 9% increase in just 1 year. How much of this is related to the passage of Obamacare? Well, let me quote the New York Times. In addition to increases caused by insurers getting ahead of potential costs, some of the law's provisions that are already in effect, like coverage for adult children up to 26 years of age and prevention services like mammogram screening, have contributed to higher expenses for some employers. Nothing